Hi, we want to talk to you today about the HIV epidemic in America. HIV infections in the United States continue to be a major public health crisis. An estimated 1.2 million Americans are living with HIV currently, and according to the CDC, 1 out of 8 people with HIV do not know that they have it. Although recent data shows that the annual HIV infections are declining by around 18% in the U.S. from 2008 to 2014, HIV continues to spread and decimate lives. Our goal today is to prevent HIV and related illnesses and death, specifically in the Louisiana area, through the reduction of people engaging in high-risk HIV behavior, increasing the amount of people getting tested, and increasing the number of people getting and receiving treatment. Through the various objectives we discussed today, we hope that HIV transmissions can be decreased and the lives of these people will not be as drastically or horribly affected by this illness.
Hi, my name is Elisa Ceballos, and today I'm going to be discussing in this video the objective of the proportion of adolescents and adults who have ever been tested for HIV. The baseline of adolescents and adults aged 15 to 44 years that have ever been tested for HIV in the years 2006 to 2010 is 66.9%, and the goal is to improve this by 73.6%, which is a target. The occurrence of HIV is greater among certain population groups. For example, health disparities associated with HIV include geographic location, gender, age, and sexual orientation. The South region has the highest rate of HIV infections in 2015. Southern states account for approximately 45% of all people living with an HIV diagnosis. In 2015, males accounted for 73% of HIV cases among adults and adolescents, with 28 cases reported in a population of 100,000 people, which was almost 3 times greater than the rate for females for that same year. African Americans are by far the most affected racial ethnic group in the United States. African Americans represent 12% of the U.S. population, but account for 45% of new HIV infections in 2015. There are also variations by age. Young people ages 13 to 24 are especially affected by HIV. In 2015, they comprised 16% of the U.S. population, but accounted for 22% of all new HIV diagnoses. We see also that gay, bisexual, and other men who have sex with other men are at an increased risk. In 2014, gay and bisexual men account for 70% of all new HIV infections. When comparing Louisiana to Washington is closer at achieving their goals. The number of new cases and new diagnoses are slightly less than the average per year. The funding received for state and local health departments and sex education provided to the public affects states achieving their goals. Some states have more easily accessible and effective HIV care and prevention efforts. For example, Washington has more liberal sexual education policies and an increase in spending from the CDC. This can mean why Washington has had a substantial decline by greater than 25% in HIV incidence over the past 10 years. If these goals aren't met, the number of HIV infections will increase across all states.
Hi, my name is Wesley Bray, and I wanted to talk to you about one of the Healthy 2020 objectives related to HIV. The Healthy People's 2020 objective that I wanted to go over is to decrease the percentage of young gay and bisexual males in grades 9 through 12 who engage in HIV risk behaviors. The baseline for this was from 2015, which is 35.2% of adolescents who engage in high-risk behaviors. And the Healthy People 2020's goal is to decrease this number to 30.7%. Health disparities related to my objective involve race, gender, and age, as well as geography. Overall, the South has the highest rate of HIV in the country. In looking at young gay and bisexual men, the rate increases for this group. Gay and bisexual men make up around 70% of the new HIV diagnoses of 2014, and gay and bisexual men also aged 13 to 24 account for around 92% among all men in their age group, and 27% when you look at just the gay and bisexual men. Many young people do not see themselves at risk and do not know how to protect themselves from infection. In the United States in 2015, 22% of all new HIV diagnoses were among the youth aged 13 to 24 years old. Of that group diagnosed with HIV infections, Louisiana had 26% of all new HIV diagnoses. Of those diagnoses, 81% were male, and of that, 78% were gay and bisexual. If you compare the outcomes of another state to Louisiana, you can see that HIV among adolescents was 29.2 for every 100,000 in Louisiana. And comparing that to another state, Mississippi, it was 20.6 for every 100,000. Mississippi is much closer to achieving the goal than Louisiana is. Louisiana also has not achieved the national goal. Overall, the South makes up the majority of all HIV cases. So some factors that impact the state is that in the South, HIV is highest because of the more dispersed population, which makes it hard for those people to seek treatment that have the disease, and the overall lack of access to care is in smaller communities can affect that goal. Louisiana also has poor sex ed and does not include preventive information for young gay and bisexual men, which can drastically affect the actions that this group takes. In our goal, we as a state must do more. Louisiana has one of the highest rates of HIV in the country, and the New Orleans area specifically has the highest rate of HIV for 13 to 24-year-old men. With that in mind, know that 78% of those were from gay and bisexual men. We can do more. Louisiana already has several partnerships and campaigns, and the CDC helps to provide for those. Some examples of that is Doing It, a national HIV testing and preventive campaign, Start Talking, Stop HIV, which helps gay and bisexual men communicate about safer sex, testing, and other HIV preventive issues. And finally, HIV Treatment Works, showing how people live with HIV can overcome barriers to stay in care. We can do more to help solve this problem.
Hi, my name is Kaylee Chronister, and I'm going to talk to you about the people that are 13 years and older who are diagnosed with HIV and were vitally suppressed in 2010. In 2010, the baseline was 46%, and our target for 2020 is 80%. This data was from the people that are 13 years and older who have HIV and their viral load was suppressed in the last 12 months, and it was also measured by the amount of people diagnosed with HIV and lived in an area with complete lab reporting at the end of each year. There were disparities by gender. In 2013, the better group was 55.5% by the male population, and the worst group rate was 52.3% by the female population. The difference between the two was 3.2%. When comparing Louisiana to the other states in the United States, I found that Louisiana is ranked second in the United States with 1 in every 56 people having HIV. In Louisiana, the 25 to 34-year-old age group has the highest number of new diagnoses of 31% in 2014. The number of new diagnoses in people aged 35 to 44 was 20% in 2014. I also found it interesting that Shreveport is 1 in 4 of the highest HIV diagnosis rates in Louisiana in 2014. The factors that Louisiana used to achieve their goals was having the Department of Health of Louisiana state that they fund the community-based health units to stop the spread of infectious disease by teaching about, treating, and reporting STDs and HIV. I compared Louisiana to Vermont because the CDC reports that only 1 in 527 people there have HIV, so I assumed that they're closer to reaching their goals in Louisiana. In Vermont, in 2010, 238 people were known to be living with AIDS, and 161 were known to be living with HIV. Therefore, only 161 people knew they had HIV and were doing something about it to prevent it from getting to AIDS. Vermont's goal to increase the amount of people being tested for HIV in 2020 is 15% of the people that are less than 18 years of age and 10% of the people who are 18 years of age and older. Another one of their goals is to only have 5 people with a new diagnosis of HIV in 2020. The factors to achieve their goals was increase the number of youth using condoms, increase the number of adults with primary care providers, and to test everyone who is sexually active. This is important because the failure to do this is going to cause more people with HIV to shorten their lifespan.
Hi, my name is Shelby Hebert, and today I'll be talking about the Healthy People 2020 Objective 14.2, which is to increase the population of men who have sex with men who report getting tested for HIV in the past 2 months. The baseline is 62.2% of men who have sex with men ages 18 and above report getting tested for HIV in the last year. The target is to increase this percentage to 68.4%. Health disparities related to HIV include gender, race, and sexual orientation. According to the CDC, more than 600,000 gay and bisexual men are living with HIV in the United States. African American men make up 40% of those diagnosed among men in the United States. 78% contracted HIV through male-to-male sexual contact. Studies have shown African Americans diagnosed with HIV are less likely to seek care and receive antiretroviral treatment to reach viral suppression. Factors that impact achieving the goal include geographic isolation, fear of people finding out they have sex with other men, time constraints, and income. Social activity may remain private, and they may not associate with the local gay community. They have a fear of discrimination that this could affect the likelihood of people taking protective actions and seeking health services. When comparing Texas and Louisiana, Texas is closer to achieving the goal. Factors that might affect this include CDC-funded community-based organizations. Louisiana only has 5, compared to Texas having 15. Texas also has 2 local education agencies to provide youth-friendly programs. Texas ranked 3rd in the number of HIV diagnoses in the United States, while Louisiana ranked 11th in 2015. But looking at ratios, Texas new diagnosis is 20 per 100,000 people, compared to Louisiana's 29 per 100,000 people. Failing to achieve this goal will result in a spread of HIV because people will continue to have sex unaware they are living with a disease.
Hello, my name is Yao Wang. My objective of Healthy People 2020 is increase the proportion of pregnant women who has been tested for HIV in the past 12 months. The baseline is there are 72% of women aged from 15 to 44 years who had completed the pregnancy in the past 12 months reported that they had an HIV test as part of prenatal care in 2006 to 2010. The new target of Healthy People 2020 is 79.2%. There are several factors affect the disparity in getting HIV tests as part of prenatal care, such as location, education, income, and disability. In Louisiana, approximately 25% of women do not receive HIV tests during prenatal care, compared to Louisiana state. In state of Alabama, the percentage of infection, the prenatal infection in newborn declines by 90% in 2015, and the prenatal exposed is 0.6% of total number, which means in Alabama, mothers that were getting tested and receiving appropriate antiretroviral medication so they are not passing it to their babies. The Division of HIV/AIDS Prevention and Control collaborates with Alabama's medical provider to increase testing, decrease incidence of prenatally acquired HIV-positive pregnant women. Many factors that affect achieving this goal, such as mother's infection is diagnosed early, the mother receives and adhere to antiretroviral medication during pregnancy, the mother receives antiretroviral medication during labor and delivery. Follow all these recommendations can reduce the rate of prenatal transmission to less than 1%. Also, access to routine comprehensive prenatal care for all HIV-positive pregnant women and their babies will help to ensure this vision can be achieved. If this goal failed, they're going to have more babies born with HIV.
Through the Healthy People 2020 goals, we hope to decrease the amount of HIV. We hope that by increasing prenatal HIV screenings, decreasing risky HIV behavior in adolescents, bisexual, and gay men, as well as increasing screenings for gay and bisexual in the general population overall, and making sure that people adhere to treatment and are virally suppressed. We as a country and as a community can come together and eliminate this horrible and devastating